Well, technology is giving healthcare something of a major boost. The platform Synapse allows medical providers to collaborate with patients and respond rapidly to their needs. Synapse allows multidisciplinary teams to conduct conversations, share medical files, and make diagnostic updates easily and confidentially, of course, from a mobile device. This does seem to cut down on the costly consultation time, never mind how much easier it is to get information. Dr Jurek Pietzrak is part of a team of medical doctors that uses Signapps to save lives every single day. He's an orthopaedic surgeon at Charlotte Maxeke Hospital. Doctor, good to have you with us. Thank you for your time here on eNCA. Synapse, I'm trying to understand, of all the information that you need, how do you try and get that into one app?
So the beauty of Synapse is that it's a care coordinating platform. It's POPI compliant. And the most important thing is that it puts patients first. So patients are at the center of this web where doctors can work around and nurses can feel like a team in order to provide the patients with the best possible outcome.
Is that because it's got a lot to do with not misinformation, not missing information, but the time it takes to get information? You know, I've been to this hospital that many years ago, this was my doctor, he's now left. Is that what this is trying to solve? So
basically, Synapse started off as a communication app, first and foremost. And what we saw was that up to 60% of lives lost are all due to miscommunications. In a 2006 study looking at 14,000 deaths, it was shown that miscommunication and errors in communication actually caused more deaths than a lack of skills. So what we've done now is we try to communicate quickly, efficiently, at that point in time with other care coordinators, making sure that no one is ever alone treating a patient, and immediately somebody can ask for help. Someone can ask for the expertise of anybody on the group or on that thread. We're able to have physiotherapists alert doctors to problems with mobilization. Nurses feel like they're part of our team. At any time they can say the patient's looking ill, and doctors can swarm. We're also able to have our professors and our senior colleagues with us treating patients simply by giving a message, even if they may be on holiday or remotely in other places.
So this is like medical WhatsApp versus now meeting the CSI of medical.
Yeah, so we felt very uncomfortable using WhatsApp. WhatsApp, of course, is a good group chat, but patients very quickly get lost in this milieu of messages. It's also unprofessional to be communicating about a patient at the same time as you're getting memes from your friends. It's also distracting when there's 15 WhatsApps and you've got to sift through them to find out where the medical coordinating team and where the patient's thread and when you're dealing with the work at hand. So we decided to create the Synapse app. So you only had doctors, you only had healthcare professionals on board. You get a message, you know, I need to take this. This is urgent. We've got to look at this. And it's evolved. It started off with communicating, and now we've gone to a stage where we're capturing data, which is very important. It also means we're including other doctors involved in our treatment of these patients. And we're able to follow patients up at all points. So patients may leave and they may complicate. They arrive at hospital at 12:30 at night. Nobody knows what's happening. Their files are locked away. In some instances at the Joburg Gen, the files are stored away where we can't get to them for 3 or 4 days. And all we do, we go to the app, we download all of that information. We're able to find when the operation was done, what implants were used, were there any things that the surgeon at the time of the operation was concerned about, and you're able to drag all that information in a matter of moments.
And I've got our camera ready for this, Doctor, so if I can ask you just maybe to unlock it. Obviously, we don't want to be showing patients private information, so we're not going to do that. You know that's on the app.
Yeah.
So we're going to ask KG, our crack floor team director, just to zoom in on your phone. While he does it, just take us through what you can on the app, because the joys of apps is it's great in being able to communicate quickly, but it has to be easy to use.
Absolutely. So the big thing about doctors is that sometimes doctors aren't necessarily always at one hospital. They may be providing care at private hospitals, at different private hospitals, and mostly at government institutions. Here you can see these are the hospitals that I was working at in the past. And in fact, when I was doing my fellowship in London, we also used that app there with great success. So you then go onto your group, which is Charlotte Maxeke, and this is the hospital environment. And of course, I've got different groups with which I discuss different things. We then have what we call our arthroplasty unit, where we've got physios, nurses, junior members of staff all the way up to our professors. And here we're communicating about things like the ward run is done, are there any clerical administrative issues? And then the big beauty of it all is that we can have private messages, and I don't want to show the patients' names, but we are able to have patients' names, and then of course we're able to red flag those patients so that at all times everybody is adding to the volume of information based on the patients that are most at need and need to have more advanced care.
And when it comes to the kind of hospitals and professionals such as yourself that can get onto this, is Synapse now available for everybody? By the way, I just realized what Synapse means. It's a play on Synapse.
Absolutely.
Very clever.
Absolutely.
By the way. It just dawned on me. Can anybody get onto this, or is there a process involved? Is there a membership?
So Synapse has now launched Synapse Serve, in which it's offering government hospitals a free admission. And they're offering a certain amount of patients and patient threads and forms that can be uploaded, which I think is wonderful. I think it's important that this is not just for private hospitals or institutions that are able to pay in. And we know that government patients need as good cares that they can. The fact that they can't afford medical aid and they can't afford private does not mean that we shouldn't afford them the best and most in-depth care. So it's a wonderful initiative.
And speaking of this initiative, I know we're going to get so many questions on eNCA, on Twitter, on Facebook, email, asking how can perhaps a medical professional watching this, how can they get involved? Do they just download the app? Do they have to phone you? Take us through that process before I say goodbye.
So the process is really simple. They have to go to www.getsynapse.com. They then need to be invited by another medical professional. So a medical professional then has to say that they are indeed a doctor, and they get invited from that. They also can contact our or the Synapse team, and the Synapse team will come and set everything up. It's the setting up of this platform, Synapse. It's the setting up of an administrator, and thereafter it's then inviting colleagues to join part of it. Also, the beauty is that there's an autobiography part. So you might get a message from a colleague saying, I've got a patient in ward 374 at the Joburg Gen. I'm really concerned about a rash. You can click on the biography and see, oh, it's Jurek Pietzrak, it's the orthopaedic surgeon. Let me see what he usually does. And you know exactly who you're communicating with at all times.
This is fantastic. Congratulations. Thank you so much for coming in to show us. It's www.getsynapse.com. It's such a clever name. It just tickles me. Dr. Jurek Pietzrak joining us this morning, orthopaedic surgeon from Charlotte Maxeke Hospital here on eNCA.